medication vial, diluent, alcohol swab, and syringe. You can read the drug label to determine the diluent, quantity of the diluent, and resulting strength of solution. Then you calculate the correct amount of medication. You're going to remove the protective cover from the diluent container and medication vial.
Okay. Now I want you to notice on these little demo doses, as will be on, just like was on the video, it tells you, even though it's small print, the concentration of prepared solution, the amount of diluent to be added, and then the resultant solution volume. So depending upon what your order is, this is what you would do. So if you were giving 500 milligrams of this, you would see, okay, 500 milligrams per milliliter. So I need to add 3.6 milliliters of the diluent, and I'll end up with 4 milliliters total. And if I have to give 500, then I need to take 1 milliliter out, right? Because it's 500 per milliliter if I put that much diluent in. Right, so...
You can withdraw appropriate amount of diluent and inject it into the medication vial. And true. Everything is in past tense.
Oh, I know that says changing. When I was reading it, I thought it was like the back.
So you would draw it up out of here. So to draw it up out of here, you would do what?
You would put air
in, right? Draw out the amount that you want. Pop this little top off. It's already sterile under there. So if you haven't gotten it contaminated, you don't have to. Some will tell you to do that, but as long as it's a sterile top, it hasn't been sitting out or anything like that. Okay, if you don't. Okay, so you would put a needle. So it must be needleless.
And agitate vial until all the powder is dissolved.
Okay.
So withdraw the correct amount of medication into the syringe.
Up into here.
And it goes straight to performance and hygiene. But wouldn't I think you would have to put a label on that?
On here?
Yeah.
Yeah.
That's missing in this checklist.
Ah. But here is, actually this looks like the label for an IV, but you're going to be adding it in here.
Oh, okay.
Okay, so this is the label for, that goes on there. So you'd fill this out, patient, room number, drug amount, added by, date, time, start time, flow rate, all of that. And you put that on your IV.
And then where do you push it? Where do you inject it in the vein?
The port.
Oh, this one?
This, you pop this little blue guy off, and you would inject it into here. And then this gets peeled off. This is where your IV spike here would go, up in there. And you can kind of tell that that's going to be a stopper
it says
behind
add.
here. Add set, IV set. Okay?